Hi there, my name's Damien. I've been a paediatric emergency medicine consultant for nearly a decade, and I'm a researcher in how we most effectively identify the most unwell children who present to our emergency departments and hospitals. The recent increase in scarlet fever and group A streptococcal disease has clearly caused alarm, and our sympathies are with those families who have been tragically affected. It's important to remember that both scarlet fever and group A streptococcus are not new disease processes. The incidence of them has been rising even before the COVID pandemic. What we're seeing at the moment, though, is a consequence of some of the measures that we put in place during COVID, and these bugs are now circulating at much higher levels than you would expect them to. Now, what this means for your children, regardless of their age, is that we just have to be that bit more vigilant about children who do have sore throats and high fevers, especially those who have the associated scarlet fever rash. This is a red rash, and if you run your finger over it, it should feel a bit pebbly or rough. It's important to note that the red rash is most obvious on white skin types, and if your child has a darker skin tone, it might not be as obvious, but the raised, rough nature of this rash is still present. Now, what's important is that parents and carers should continue to do what they've always done with unwell children. Fever is a consequence of disease, and it is the body's response to trying to fight that infection. Fever on its own doesn't do any harm, and it's just a signal that the body is trying to fight the infection. If your child does have a high fever or temperature and they're distressed, they can certainly have some paracetamol. And what should happen is the distress should be alleviated, and the fever should last no more than 3 to 4, maybe 5 days at the very most. If your child's fever persists for 5 days or more, or during the time period that they have the fever, they're extremely drowsy and you can't wake them up, or they're breathing very, very fast and hard, then you do need to seek medical attention. But the other important thing to look out for is your child's level of hydration. Children can actually go for a couple of days without eating anything solid, but do need to drink regularly, and those fluids do need to contain a bit of sugar and salt. Please don't just give your child water alone for a couple of days. The best sign that your child is well hydrated is the amount of urine or wee that they are producing, and especially if your child is still in nappies, they probably should be having at least a couple of wet nappies a day. Certainly if your child hasn't had a wet nappy in 12 hours, that is something that you need to seek medical help for. But by and large, most children can be kept hydrated with small sips of fluid regularly. You can give them small amounts, but over a long period of time that adds up to quite a large amount of fluid. And again, if they're having regular wet nappies or only slightly reduced wet nappies, that means that they are well hydrated, and when the disease process is passed, they'll go back to having their normal appetite. If your child has a fever and a sore throat and does develop this red rash, particularly over the trunk or body, then again you should seek medical advice. Doctors are now all aware that we have the more circulating bug, and so if they see that the rash in association with a fever and sore throat, are likely to give you antibiotics. However, if your child simply just has a cold and a runny nose and has a fever and without a rash, that doesn't need antibiotics, and those conditions can be managed at home. The provisos to that are, if your child is less than 3 months and has a fever, you should always seek medical advice, and that has always been the case. It is scary to hear reports in the news that children have died from this condition, but that is still a very rare event, and there are lots of children out there who have this infection and actually don't receive any treatment at all and recover completely without any need for intervention and suffer no long-term harm. There's lots of information available on the websites, and please either go to the 111 website, which you can just Google, or phone 111 if you have any concerns. Thank you.